conversation is about something that luckily most people will never see, but it directly determines whether mothers and babies stay safe when pregnancy gets complicated. We're talking about maternal enhanced and critical care, and the remarkable story of how one region built the infrastructure to support the 1 in 10 women who become critically unwell during or after pregnancy.
Once we started to collect the data in each of the individual units, we were then able to start to understand a bit more about why those women become unwell and how many do. So we've got about 7,000 cases in the database now. And when you look at the average number of cases that each unit is having, roughly speaking, it's about 10% of women, all women who are booked in any unit will become unwell enough to need enhanced maternal care. That figure of about 50% of women not having any underlying health problems, I think possibly came as a bit of a surprise to various sort of national groups who are looking at care of women who become unwell in pregnancy. I think what it's highlighted is that actually having somebody or everyone who has an interaction with a woman in pregnancy, the importance of them recognizing early signs of deterioration. So every single one of those 7,000 cases has been manually data entered by a member of staff in those individual trusts. So that is hours and hours of people's time, which if they didn't want to do it or see the importance, just wouldn't have happened. So we're hugely grateful to everyone who's been involved in this.
And when it comes to data, come join us, collect the data. You know, when you're working in trusts, there's lots of different specialities that are competing for, you know, funding and everything for different aspects with it. Collect the data, then you would have evidence behind you to, you know, say, right, actually, we need to do this training. You know, this is the level of care we're providing. We want to enhance that care.
I think the other kind of times where it kind of makes me stop and think about it is when either in my own unit or in someone else's unit, I hear somebody describing the care that they've given as that's just how we do it around here, and knowing that that is the work that we have been doing for the last 10 years and that it has become embedded as normal practice.
In that, you know, we started the data collection during COVID. What a time to do that. And everybody has been on board. Every single trust has been on board. You know, it's been a wonderful collaboration to be part of and to be part of a name of, you know, and that's including, you know, you know, case capture, it's Athera, net solving, everybody has worked together. And that's what I love. It's the team looking to work together to improve care for women.